Hello, everyone. This is Mehreen Fatma, and I will be talking about my key informant interview guide in this presentation. And my topic is how do nutritionists or dietitians use counseling strategies, or what challenges do they face uh, to promote dietary adherence among type 2 diabetes patients. So I just want to ask you guys in general, what do you think? Why is type 2 diabetes most common among older populations? And then what strategies or what counseling strategies or barriers do you think dietitians use today to promote dietary adherence, specifically among the older population? Okay, so I will be in this presentation. I will outline the purpose of my interview study and share the key findings from the literature I have reviewed. And I will also explain the process and context of the project, including the objectives I aim to achieve. And finally, I will present several of the key, several of the interview questions that I plan to ask nutritionists to explore their strategies and challenges in promoting dietary adherence among older adults with type 2 diabetes. So, as I talk about my population or focus group is older population with type 2 diabetes, and the key informants are the nutritionists and dietitians. But I just want to take you guys back to think of why it is common, like I asked in the beginning. So the research I did, I have come up with the reasons that um, it could be the age-related changes in their body, the physical activity, the barrier is could be the physical activity, long-term weight gain could be one of the possibility, or might be their exposure to poor diet, or there are other metabolic health conditions that can lead to the or cause the type 2 diabetes among older population. So let me see. There is a bar over here that you can see. This is a survey data from 2025, Common Ground Health. And it shows that the prevalence of diabetes is significantly higher among adults, older adults, as compared to younger adults. And it is from the Finger Lakes region of New York. Okay, so in this slide, I will be talking about the purpose of my interview. Nutrition counseling that emphasize healthy lifestyle has been shown to improve glycemic control among older adults. And this interview, the aim of the interview is to identify and examine the strategies nutritionists employed during their counseling sessions, and how do they facilitate and sustain patients' commitment towards the behavioral change. And the purpose of the statement, the interview, is to explore the barriers and difficulties nutritionists experience when addressing complications associated with type 2 diabetes in older populations. Okay, here is the literature review that I did on my topic, and you can see the picture on the bottom. This is from the article from Frontline from American Diabetes Association, and this, based on the article, it promotes a system level approach that do support nutrition counseling as a part of a broader integrated real world diabetes care model. And the article discussed some barriers and challenges to nutrition counseling and in the real world setting, which includes that patient often have differing socioeconomic background, which could be the low income, food access, literacy, which makes standardized dietary recommendations difficult to implement effectively. Also, but overall, this is a 6 month randomized controlled trial, which shows improvements after the study. There are some gaps in the research I did, and so some of the research articles do talk about health. Plan models or like education strategies, but they do not specifically focus on the social determinants. But in some of the articles, the social determinants are mentioned, but it is lacking what specific counseling strategies or what exactly what challenges a nutritionist faced when they counsel specifically older population. There are some articles that are based on like diabetes, how to address the diabetes issue, but not specifically addressing towards the older population. Okay, now here is the process and content objectives that I will be expecting, that I will uh, expecting to gain from this interview. One of them are the content objectives and the process objectives. So first, I will be talking about the process objectives. I will use open-ended questions to prompt key informants to describe their experiences, and I will also apply ethical research procedures to obtain their consent in audio recording, or to inform them how the data will be documented. And the two of the content objectives will be that after the interview, I will be able to describe counseling strategies and at least identify 3 to 5 key challenges that dietitians face when they counsel patients with type 2 diabetes. Also, let me see. Yeah, that's the process and content objectives. Now the how I will what are the methods that I will use to design this interview, or how I will perform this interview is, first I will send an invitation email to all the dietitians who work at my facility, and let them know about I will be doing this project and the details of this project and how it will be conducted, and then subsequently follow up with those who express interest in this. And then I will explain the project, its purpose, how it will be conducted. And I will also, depends on what works best for the participants. It could be either in-person or Zoom interviews. I will choose whatever works best for them. And then I will inform them and ask about their consent, that if this interview can be audio recorded. And I will inform them also that the recorded data will be kept on the password protected device. Okay, here are the interview questions. So whenever I will do this interview, I will start with the icebreaker question, which could be like from 3 of these. So I'll start with like one of them could be like, if they can tell me about their experience as a nutritionist in this facility, or how long have they been working specifically with older adults with type 2 diabetes. And what differences they have noticed. I will try to ask them to explain any experiences they have specifically with older population, and what are the differences they see as compared to the young adults. Uh, and Yeah, and then the follow-up or the probing question could be let me see. So yeah, we can do like if they can describe any counseling strategies they use when they work with older adults, and which specific nutrition interventions are most important for them, which they think can be beneficial, or the most beneficial for the patients. And I will also ask them what techniques they will typically use which could involve goal setting or motivational interviewing, and what feedbacks or responses do they observe from their patients. There are also other main follow-up probing questions relevant to the environmental determinant, and which could include what strategies do they use to assess whether the family has a positive impact in promoting dietary adherence, or they are not, or the family members or friends are not really helping. I will ask them if they can share an experience they have this, and how do they face that challenge, what strategies they use to overcome that challenge. Okay, guys, that's my key informant interview presentation, and thank you so much for listening.